you will either have an impact on the person's independence, you will either have an impact on the person's safety, you will have an impact on the things that matter to the patient, meaning the things that are of value to them, and you will have an impact on the quality of their performance. Hello, welcome and kumusta. Thank you for joining me. This is How, and I am your occupational therapist. Welcome to Occupational Therapy Conversations. This is Riot. Could be a relevant information involving occupational therapy, random information involving occupational therapy, rants involving occupational therapy. Lots of things. Whatever the discussion, it's going to be a riot conversation. Okay, so we want to talk about effectiveness and impact. Oh, that is such a very big term, isn't it, guys? So here's the scenario. Every now and again, as occupational therapist, you will be asked to present and demonstrate and show your effectiveness and impact, which is a very difficult thing to prove. So you can have outcome measures out there, you will have outcome measures, but these outcome measures or evaluation tool can only measure the thing or the things that it measures. For example, if you are an occupational therapist whose concern and whose work is focused on addressing somebody's strength, then the manual muscle testing would be your measure for that. That would be your effectiveness. That would be your impact. And if you are working with range of motion, then your effectiveness and impact can be measured based on the goniometer and the changes of the joint range. Now, when it comes to occupational therapy, that is a big concern. Specifically, if the one that's asking for it would be NHS, and the ones in the NHS, who are the people in NHS that would be asking for this? The managers, the nurses, everybody is in search of this effectiveness measure, of this outcome measure. Everybody would be keeping an eye on your impact. And it is such a broad area. It is such an abstract thought that your impact is so difficult to measure. Let's go back to our concerns, our domains of concern. One of the domains of concern is spirituality. What is your impact as an occupational therapist? What is your impact on spirituality? Boom, big question, hard to prove, isn't it? What are the measures for spirituality? Boom, it's hard to measure. Okay, let's change that. Remove the core or the spirituality. Let's go for the volition, the values, the interest, and the personal causation. These are the parts of volition. How do you measure values of a person? How do you measure the interest? What is your impact on a person's personal causation? That is very difficult to do, isn't it? And what about the roles and habits? These are our concerns. These are something that we are addressing. It's very hard to measure and to present these things. And until we are able to present that, it's so hard for people that invest on us to give money, because the question is always, why would we give money to you? Say you're in the ward as an occupational therapist and there's only one of you in one very specialist ward and very specialist unit. And then you present the impact. You ask for more staff. They would ask why. Why would you want more occupational therapists? What would be the impact? What would be the impact of more occupational therapists in the ward? That is very difficult to measure, because occupational therapists in some levels go on the field of psychology. We go on the field of sociology. And these are very difficult to measure. If you're an occupational therapist working in the physical dysfunction, it's much more easier to measure the impact on that level, isn't it? If you're in the hands therapy, it's easier to measure the impact because can you or can you not use the hands? That would be the impact. If you do something for the person to use the hands, that's easy enough. What about if your job is to provide wheelchairs and to measure for wheelchairs? What's the impact of what you do? There are more people who is able to access the wheelchair. There are more people that can access the community. So the impact is so far down the line. It's like a ripple effect. It's like a stone. You throw a stone in a pond where the pebble falls onto the pond, and then the ripple effect, that is the impact. How are you going to measure that in such a short period of time? What about if you're working in critical care? What is the impact of your service when you're working in critical care? You need to be more creative about these things. It's hard, isn't it? I have some idea, and I'd like to share that with you. At the end of the day, as occupational therapists, what we do is help. What we try and do is resolve issues. Okay? And I've always been a believer of this. You would hear this in my episodes. At the end, I always say this. Everything you do matters and has an outcome. Everything that we do matters and has an outcome. And we're not wasting time in the hospital. We're doing something. We just want to be able to present the outcome of the things that we do. And the things that we do will fall on one of three categories. Like I said in my previous episodes, it can be on the category of assessment, problem identification, goal setting, and discharge planning and treatment planning. And then it can be on the category of treatment and interventions. Okay, so there we go. So you're an occupational therapist in the hospital and you're doing something, and what you do falls on the category of assessment, discharge planning, and direct intervention. So when you do the assessment, any form of assessment, what is the impact of that? What is your impact on assessment? What does the result of your assessment do? What does it do? And what are the problems that it resolves? Mind you, you're just assessing, right? So when you're doing an assessment, the outcome, the problem is something is not known. The problem of not knowing. So you do cognitive assessment. Why do you want to do the cognitive assessment to begin with? Because you have a suspicion that a person has cognitive impairment. So what is the problem? The problem is that you do not know the extent of the cognitive impairment. And then if you do not know the extent of the cognitive impairment, what do you want to do next? What you want to do is you want to know the extent of the cognitive impairment. How are you going to do that? You're going to do cognitive assessment using whatever standardized tool that you have that you need to use. Say MOCA or MEMS, MMSE, Addenbrook's cognitive evaluation, OSCOG, all of these cognitive screening tools. So once you've used this, so that was your intervention, then you will have a result, the outcome. And after you've done the outcome, what's the outcome? Say you've done the MOCA, so the person had cognitive assessment and the score in the MOCA is 21 out of 30 with problems in delayed recall in attention and attention. So there you go. So once you've established it, the next thing that you need to ask is then, have you achieved the goal or have you resolved the problem? By doing the cognitive assessment, have you now resolved the problem of not knowing the extent of the cognitive impairment? The answer will be yes. Okay, there we go. So that's one. Assessment is something and it will yield a result. And the problem of assessment is the state of not knowing. And the result of that, when you do your assessment, the result would be that you will know the assessment. Okay. Say, for example, you had a meeting with the next of kin and with the family. You ask yourself, why are you meeting with the family? You have salient and unconscious reason why you want to meet up with the family. Perhaps because you want to meet up with the family to find out if the family can help on your patient's personal care. So that would be your objective, to establish if family can assist with a person's personal care. What was your action? You interviewed and you spoke to the family. Why did you want to do that? Because you want to know. Why do you want to know? Because you don't know. Why is it important for you to know? Because at some point, you will be able to establish if family can or cannot. Why do you want to know that again? If they can, then that's good. That's problem solved. But if they cannot, then it's yielding another problem. And what's the problem now? Okay, the problem would be the patient's family cannot provide patient's care needs. And then what do you want to do? Patient will have assistance with personal care. How is he going to have that when the family can't do that? You're going to refer to reablement care and put up reablement care to help the patient. So once you put up the reablement care, what did it do now? What it does then is that the patient will have assistance with their personal care. Easy, isn't it? So what kind of intervention was that? That would have been supportive intervention. Create and support intervention. Okay? And that's what it is with occupational therapists. We are resolving issues, and we are resolving issues by restorative means, by supportive means. Say, for example, you have done washing and dressing. Practice. Why did you do the washing and dressing practice with the patient? What was the problem? Because the patient can't do it. Why did you do it? Because you want the patient to do it. What's your objective? The patient will be safe and independent with their washing and dressing. What was the problem? The patient can't do it. How are you going to achieve safety and independence? By practicing. After you've done some practicing and within a period of time, then the patient could say that they are now independent with their washing and dressing. How are they able to do that? Because you've done the practice. So what was the outcome? Patient can now wash and dress. Did it resolve a problem? Did washing and dressing resolve a problem? Yes, it does. But you have to make sure that what you're doing is resolving the appropriate problem. You have to have that very basic and simple logic. And just to give you some background, when I was doing my training in another country, logic was part of my course as an occupational therapist. And at first, I couldn't understand why we need to have that training, the logic. And then now I realized that it is very useful when you're working in the field of science because you answer the question that's being asked. So an application of logic is what? Like a colleague of mine, a younger clinician, younger in the sense that they're fresh from the university. They said they've given them a therapy. Then I asked, why did you give the therapy? He said, what was your goal? To improve dexterity. That's what she said, to improve dexterity of the patient. And this is a patient who had a knee surgery, right? I asked, you gave the person some therapy to improve the dexterity. Why? Was there a problem in their dexterity? No. He was saying, because he's really down, he's really a bit depressed, so I gave him something to do. So you meant to say, based on that, the problem was the patient has a low mood, and your objective then would be to improve his mood. And how do you want to improve his mood? Give him some activities that can stimulate him and in a way will have an effect on his mood. And then in the end, the staff said that the patient was happy after the session. And that was the impact. So really, the therapy was not intentionally done for the upper limb, although it looked like it does because it gives the dexterity, but it was never the problem to begin with. The problem was the person has issues with their mood. And with mood, what are the treatment for mood? Engagement and participation. You can have object relations approach by talking to the person. You can have behavioral approach. You can have cognitive behavioral approach. And by doing all of these things, then perhaps it can be mood alleviating. You can have activities, gross motor activities, sensory integration for the grown-ups by Lorna Jean King. So this can alleviate the mood. So you see, there you go. The impact, I think, and I know for sure that the impact of therapy can be shared and can be presented in our documentation. If we focus on the amount of problems that we are addressing and really zeroing in on those things that matter, meaning it's not a pushed objective. It's really something like down to the core that you have really resolved somebody's concerns and issues, then yes, you can present the impact. But you have to break away from the rules of goal setting. What are the goal setting? That's a killer for flow. Smart goal setting. This is the killer, okay? Because it now just becomes an exercise. So you're not really doing anything. You're just complying with the SMART format, but you're not really addressing the issue. But once you listen to the patient, then you'll find out it's a mutual thing. The patient could have a problem and you can have a problem as a clinician. So your processes has an impact. Your investigation will have an impact. Blood test. What does the blood test do? It's not a treatment, it's diagnostic. Why do you want to do the blood test? To establish some abnormalities in the blood. It's diagnostic. So you can have an impact on diagnosis. And how would you have an impact on diagnosis? This is technically assessment from the therapy's language. Okay? So there is an impact on our assessment. There will be an impact on problem identification and goal setting because it will change the direction and the intervention. And again, it's something that you do, something that you have done, and you have acted on that, and therefore you needed to be compensated for that as therapist. And then the direct intervention will have a change. And either these are the few changes that you do when you have your intervention. You will either have an impact on the person's independence, you will either have an impact on the person's safety, you will have an impact on the things that matter to the patient, meaning the things that are of value to them, and you will have an impact on the quality of their performance. Either you have made their performance easier or faster or with less pain. Okay, if you go back to some of the episodes that we've had over the years or over the year, it's the parameter of assessment and intervention. It's visa, going back to that again. Okay, right. There's a lot of interplay here between the parameters of your assessment and intervention. And the outcome of that will either be a person would be independent, safe, and would perform much better. That's one outcome. If you're dealing with the performance area of ADL, you can have an outcome of knowing and diagnostic, meaning from an OT, diagnostic information is knowing the state of their functional abilities. Okay, this is the diagnostic service or the diagnostic perspective of occupational therapists. And there you go. Those factors have an interplay with one another. The parameters of assessment intervention, how we're addressing the problem, and how we are actually resolving the issue. And the issue could be that of not knowing. You need to know, so you need to know the direction of your intervention or if there is a problem, or you need to know so that you know the problem and then you can address those problems. Always remember this, guys, okay? There is a wider thing that's going on. You cannot be confined in the one place. It's not just a one page of the book that you need to understand. You really need to understand the entire concept of what is really happening with our patients. If we want to get and present the impact, a few things we need to do. We need to be prepared to change our processes, particularly with documentation. We need to accept that our impact is very hard to measure on an individual capacity because impact is abstract. But what we're really doing is we are resolving an issue or issues, okay? That is if there are issues, but we're also identifying. So we're also diagnosing. And that is through the act of assessment, okay? So knowing, resolving, and directing. Those are the three general impact or general outcome of what we do. When you do an assessment, when you do goal and discharge planning, then you know the direction, okay? And then the last part would be changing, okay? And that would be the intervention or changing or restoring or preserving and preventing. Okay, guys, thank you so much for taking time to listen to this episode. This is very tricky, very sensitive. Let me see if I can write these down in a much better way, or I can come up with a better study and presentation for you guys. This time we just talked about impact and presenting the impact of occupational therapy. I hope you learned a little something. If you did, just have a conversation with your friends, have a discussion, have these active conversation and debate and discussions. Talk about ideas, because when you do, you grow, okay? Just remember, anything you do, anything we do matters and has an outcome. Until next time, bye!
If you enjoyed this podcast, talk to your friends and colleagues about it. Like it, subscribe, share, and do what you can to appease whatever algorithm that is at play. Just remember, guys, anything you do matters and has an outcome. Until next time, bye!